Hi there, Annabelle. Thank you so much for joining us today to share a little bit more about what you do and how you can help support women that may be navigating a diagnosis of PCOS, or perhaps even women who feel like there's some changes happening in their body and perhaps they've been dismissed or they really don't know how to piece that puzzle together. And perhaps you can share some insights from your perspective on helping women make sense of their symptoms.
My name's Annabelle and I'm a dietitian. I've got a special interest in women's health just because I think women need so much more support. And I'm so happy to be working with Preet today because I think women need support throughout, different areas. And I think exercise, feeling strong and diet go hand in hand.
It often takes a village. You need good nutrition to support muscular growth or tendon regeneration, whether you're coming off the back of an injury or whether you're just trying to get stronger, particularly if you're someone in your 40s who is very privy to all this information, knowledge around, perimenopause and how we should all be eating sufficient fiber and protein and to help that muscle growth and development. So today we really want to highlight one of the actually most common metabolic conditions that actually affects women of reproductive age, PCOS, otherwise known as polycystic ovarian syndrome.
So from my perspective, when I think about PCOS, I guess we look a lot more at insulin resistance. As a dietitian, I don't do the diagnosis. So a lot of my clients already come through, with pre-existing diagnosis. But I will say, I think you feel the same as well. As allied health practitioners, we get to spend a lot more time with our clients, and sometimes clients don't necessarily go to a gynecologist as their first point of call. From my end, I might have clients struggling with, a few different symptoms. So things like the acne, which is a really common one, struggling with blood sugar control, feeling like they've got lots of sugar cravings, as well as weight. And I feel like, for that weight, it's a lot more of a visible symptom that people feel. I think it's different from this, weight gain that is expected. For a lot of people, it's struggling with, I feel like I'm, eating what I should eat. I feel like I'm moving my body, but the weight feels stubborn. It feels different. It doesn't feel like my body anymore. And I think when a few of those symptoms come together, for me at least, it is a flag to go and get checked out. And to be honest, for a lot of my clients, it's a bit of a relief when they actually get a diagnosis to know what's going on and to sort of be validated. That I think when you don't feel that something's right, often you're probably right about your own body, I think.
Yeah, absolutely. That gut feel around things, it's something not to be dismissed, right? And I think sometimes it can take a few attempts, can it not? Because everyone has a slightly different knowledge base or interest. And, perhaps you've gone to someone that's trusted, but perhaps they weren't able to piece that puzzle together. And so you end up seeing someone else. And it does, unfortunately, take a few attempts to find the right clinicians to help you find a diagnosis and make sense of your symptoms. And that's actually quite prevalent in what the literature is saying as well.
So amenorrhea, or having infrequent periods or not having a period for a prolonged period, is probably the most common one I see. So some of my clients, they might have 4 periods a year. They might go 2 or 3 months without a period. And along with that usually comes, a few other symptoms as well. So excessive hair growth is probably quite a common one. I will say with that one, though, it is also subjective. Across different cultural backgrounds, different ethnicities, people also experience different patterns of hair growth. But I will say if anyone feels that, what they're experiencing feels different or uncomfortable for them, then it's definitely worth getting checked out. Acne is a really pesky one that, literally is really front, facing it. And I think that's something that bothers a lot of people. Weight gain. So especially around that abdominal area, really stubborn weight gain, weight gain that's not moving is one. Hair loss can be another symptom as well. Skin tags for some people. Although I will say, as we know with PCOS, it does present so differently. So sometimes I get 2 clients in the same day and they can present, completely differently. Their symptoms are completely different. And I think sometimes, especially with clients who present a little bit differently, they feel like they're not part of this larger conversation because, we talk about weight gain a lot, but some people don't have that symptom. Some of my clients have no issues with weight whatsoever. Maybe it's just a period. Maybe it's just the acne. Maybe it's actually fatigue and just, struggling with feeling well and strong, and all their bloods, are not great either. So I feel like everyone presents a little bit differently, and there really is no one size fit all. But statistically, I guess amenorrhea and infertility are some of the common ones that we see.
Yeah, absolutely. Just to that point about not presenting typically, I think that's what often leads to a delay in diagnosis, right? And we do have a number of women who have come to the clinic who, aren't presenting as someone being overweight, yet have all the hallmark symptoms of a PCOS presentation, but no one's actually taken that seriously. But just speaking about weight gain in PCOS, what role does diet play in helping one manage their symptoms in PCOS? We obviously understand that we don't really know why women get PCOS. The research is talking a lot about there being perhaps a genetic predisposition to developing PCOS. And, things like perhaps even environmental factors or lifestyle factors playing into PCOS. What would be the dietitian's stance on how one might navigate a healthy diet to help support their symptoms?
So I feel like with PCOS, it's tricky. I think it's something that has gotten more airtime recently, which is great. But I also think there is this conversation about, a diet to fix your hormones or correct your hormones, and it doesn't quite work so directly. There is no magical supplement or food that you can eat that will correct your hormone levels necessarily. There are definitely things you can do to support your hormone levels, and I feel like the biggest part of that is blood sugar control. So learning how to eat in a way that supports stable blood sugars is probably going to do the most for things like inflammation and your hormones as well. And when it comes to blood sugar, it's not about cutting foods out. It's just about pairing your foods, because we still need carbohydrates. We still need energy to go out throughout our day. But by balancing our foods across the different food groups, it sounds really basic. It's not going to, make for any sensationalist headline, but balancing your core food groups is going to give you the energy you need, but also keep your blood sugar stable. And I think that's the part that's missing. Often with PCOS, people go straight to thinking about dietary elimination, so cutting out carbohydrates, cutting out dairy. But we know that cutting out food groups doesn't necessarily make us, healthier. We also know that from the gut health perspective, and I think the gut health and women's health area is truly evolving. It's completely different now from even 5 years ago. We know that our gut regulates a lot of our hormone levels as well. Supporting our gut health is through having diversity, and we really want to avoid cutting out food groups. So my biggest advice there is balancing all that out. With the weight gain, it is hard, but there's also a line where we don't want to keep cutting or reducing calories, because everyone needs, nutrition to go about your activities, even to do any sort of exercise that you want to do as well. So it's about getting enough of the good things and balancing out in sort of a smart and savvy way. What kind of client would come to you that would make you think that maybe they should go seek out, getting more investigations done around possible PCOS?
Yeah, great question. I think this is something that I've learnt in my time working with women. So as a pelvic floor clinic, we see a lot of women present with things like, incontinence and prolapse and sexual dysfunction, so pain or difficulty with penetration. And the first time I was curious about PCOS is because I was starting to see a lot of women who were presenting with their main concern being, pain and difficulty with penetration. And when you go through their history, there was no obvious endometriosis diagnosis. But what was common was this: at some point in time, they were saying that they were missing periods or having infrequent periods, and they'd been placed on birth control to manage that without any specific diagnosis. And then I had a couple of women who had been diagnosed with PCOS and who were presenting with similar pelvic floor changes, so stiff, tight, sensitive pelvic floor muscles and the difficulty with penetration. And then over time, we saw that evolve, that actually perhaps there is a correlation in women who have PCOS and underlying pelvic floor dysfunction, because it's what we want to do is always want to paint a picture or build a story around why someone is presenting a particular way. And where endo had already been excluded, perhaps PCOS was actually that driver in terms of their symptomology and presentation. So what we've come to realize is, albeit in the literature, there's very little research around pelvic floor dysfunction in women with PCOS. But what we've seen in the clinic is that perhaps there is. And through further digging, we're starting to see a little bit more research around that insulin resistance in PCOS sufferers, but also in women who perhaps suffer gestational diabetes. So if you have PCOS, you're more likely to have gestational diabetes in pregnancy. And what we have some research on is that women who do have a gestational diabetes Their pelvic floor doesn't change in the same way as a non-PCOS sufferer does. So what does that actually mean? So if you don't have PCOS, typically what will happen is with your pelvic floor throughout your pregnancy, because pregnancy is a load, your pelvic floor muscles, particularly the deep pelvic floor, the levator ani muscles, get thicker. They build muscle bulk due to that weight training from the pregnancy. But also what we then see is that the levator hiatus, so basically the space within which your baby comes out of, in normals, that space will actually widen. But in women who suffer PCOS, their pelvic floor muscles don't undergo that level of hypertrophy. And also that levator hiatus actually is a bit more narrow. And that may be putting these women with gestational diabetes at risk of, perhaps having an emergency C-section, shoulder dystocia, for instance. So that's where we've seen the pelvic floor piece come into play at the clinic. So in women who have that insulin resistance and perhaps go on to also suffer from gestational diabetes, having those labor challenges. And so we want to be working with those women in pregnancy, in supporting them in their birth preparation, creating more space and less resistance to the movement of the baby as it descends through the birth canal. But earlier on, women who are perhaps trying to fall pregnant and they've realized that there's difficulties with penetration, we're also working with these women in optimizing their pelvic floor compliance to be able to achieve that. So that's where we're mostly seeing PCOS crop up in our patient population. What we'd like to see is women coming to us who perhaps have been diagnosed with PCOS and seeking our knowledge and advice around exercise as a form of management for their symptoms. As we discussed, there's a lot of comorbidities that happen with someone that has PCOS. We know outside of the changes to their menstrual cycle, they might be suffering from that impaired glucose intolerance. They might be suffering symptoms of anxiety and depression, or that body image distress, or they might be suffering from, like you said, the acne and the hair growth. Like whilst as physios, we can't do a lot for the acne and hair growth, but we know very well through the research and literature that exercise and movement is a great tool to manage that anxiety and depression, to help improve that low self-esteem and improve that body image satisfaction, as well as managing one's insulin resistance and also their cardiovascular risk.
I'm so glad you brought up gestational diabetes. I feel like with PCOS, that's the part that's often missing. I think in sort of, social media, on Instagram, on TikTok, everyone talks about balancing your hormones, in this very trendy,
Yes.
5 a.m. to 9 a.m. drink a green powder Pilates regimen kind of routine. But what we miss is talking about the related conditions. And I think this is the big power of us discussing women's health, is so many people have lived with PCOS for many, many years, and they don't think anything of their symptoms. I think it's the same thing as, all your other sort of women's health conditions, where these conversations may lead someone who is currently having maybe like really long periods, maybe a little bit of excessive hair growth, maybe struggling with their weight little bit, because it doesn't have to be, extreme, right? These symptoms put together can start to put a picture together that someone has PCOS. And with that diagnosis, we can support people to reduce their risk of future things like type 2 diabetes, future cardiovascular disease as well, because we know that in terms of long-term quality of life, these are the big things, that affect our health, when we're in our 60s, 70s, 80s, if we've got diabetes or diabetes complications. And I think a PCOS diagnosis can be empowering because, number one, same thing with gestational diabetes, and we know those two conditions are related as well. If you know that you have it, then all these other lifestyle things you can put in place to prevent things like type 2 diabetes coming up down the road. So I think that's the power of it. And I think sometimes when we miss that discussion, we're doing people a disservice where we're only focusing on the here and now, but not empowering people with this long-term goal where maybe you're making lifestyle changes right now. Maybe your weight isn't quite moving in the direction that you want it to move, but by just eating nutritiously, by doing exercise, by putting on muscle in itself, you're already, reducing your risk of long-term type 2 diabetes, which I think is more powerful than any short-term sort of goal can be.
Yeah, absolutely. And alongside that type 2 diabetes, helping improve your outcomes of developing things like hypertension, your higher levels of triglycerides as well. And I think, what is so confusing, being a woman, is that sometimes these symptoms are so generic. They could mean one thing or they could mean a lot of things. And so how does one go about making sense? And I find women, we're such troopers, right? We'll go on and we'll keep on soldiering until it's really broke, before we seek care. Do you have any particular advice around encouraging women to kind of reach out sooner rather than later?
I think a lot of it really comes down to how you feel in yourself.
Mm.
If your little spidey sensors are tingling and you feel like something doesn't feel quite right, it's always worth getting checked out. I can't tell you the number of people I see that have been, worried about, and I think often people are busy. People have children, families. They're
Yes,
worried about a certain diagnosis, and it's nagging at them. Like they feel like they're not doing a good job as a parent because they're not taking care of themselves. When really it's just, a 2-hour appointment to either know that something is wrong and what is your plan to manage that, or to have that peace of mind. And I think so many people tell me that peace of mind is worth, lots of money. And I
for
think
sure.
that's the big part. I think if someone's considering it, definitely, worth getting, an opinion. And I think sometimes if that first opinion doesn't sit right, if you're getting a second opinion, is completely
Mm.
reasonable as well. Because as you say, PCOS can present in many different ways. In most areas of women's health, practice can be lagging behind research as well. So, getting an opinion that sits right with you, getting someone who makes you feel heard. I think, as women, we have to advocate for our own health. And if you, see someone and you feel well supported, that is ideal. And if, a certain care practitioner doesn't make you feel that way, then it's possibly worth getting a second opinion as well.
Yeah, absolutely. And just speaking about how to get diagnosed, how might one go about getting diagnosed? Annabelle mentioned earlier, there might be infrequent or absent periods. Normal cycles range between 21 days up to 35 days. And so women often fall outside of that bracket. Outside of the acne and the facial hair and, the thinning of the hair as well, there's actually a blood test women can take, where they measure your androgen levels, like your level of testosterone, because typically women will have higher levels of testosterone compared to normals. Or in the more recent guidelines that were brought out in 2023, a blood test that picks up the presence of the AMH, the anti-Mullerian hormones presence, that might be also indicative of PCOS, alongside actually undergoing a pelvic ultrasound to see if there's any of those cysts, that typical string of pearls like presentation in the ovaries, is the other way to actually achieve a diagnosis of PCOS. But often what we're finding is when women do get diagnosed with PCOS, they're often offered two things. It's the metformin and it's the birth control. I'm worried this might be outside of your area of expertise, but I'm just going to ask it. Do you think that's the right approach, that people should just be put on medication straight up?
I think it's tricky. I think medication definitely has a role, and I feel like the lifestyle change takes time. Very few people can change their diets completely overnight, whereas with taking a pill, that's a little bit easier. So I don't think it's a all or nothing, mindset of definitely not. I think definitely speak to your doctor about it. I think most doctors actually do welcome that conversation of lifestyle. When you're seeing a doctor, they have no way of telling, how motivated you are for a lifestyle change or what capacity you have. You might be going through a really stressful time at work and really have no bandwidth to think about lifestyle change at the moment, in which case medication can be really important. Or you might be someone who's really motivated and want to try, lifestyle for a little while. But I think that discussion has to be had, and there's definitely very strong research to suggest you should do both together. I think medication should never be used alone. Lifestyle can always support it, but I also think that, just because you're going on medication doesn't mean that you don't have to do lifestyle, or that lifestyle takes a back seat. Both can always go hand in hand. And also that idea of once you stop medication, you can never stop it. That's not true either. Lifestyle can keep up. Lifestyle can maintain. There's always an option of coming off medication if you need as well. So I think going, both hand in hand, or really having that discussion with your doctor, can be really powerful. But lifestyle can also, be as, if not more important. And I think with lifestyle as well, it fits into all the different areas of life. So when we think about, diet change, activity, exercise, it doesn't just support PCOS or better hormonal health, or even better energy levels. It supports all areas of health, including, long-term risk of different cancers, metabolic conditions, and mental health is, I guess, a big part of that discussion as well. What would your advice be for a client who's, coming to you and they've been offered either lifestyle or medication, or they're not sure about the medication?
The phrase is, if exercise was a pill, it would be the biggest selling pill out there at the end of the day. And to your point that we all are busy, we've got multiple priorities and we need to be everywhere at the same time. And I think, medicine has a huge role to play, but that needs to be assessed in conjunction with your treating practitioner. So typically you might go to your GP to begin with, presenting with your symptoms, and they may refer you on to a gynecologist for a pelvic ultrasound and workup for that diagnosis. So I totally agree with you that medicine has its place, but it's not one or the other. It has to be both. And yes, starting off with medication may be in line with what your expectations for your management are moving forward, but we know that dietary changes, exercise over a long period of time are going to manage your mood, your future risk of developing these comorbidities around, hyperlipidemia, high cholesterol, hypertension, and your type 2 diabetes, but also help with body image satisfaction and managing your weight longer term. And I guess, you might have a diagnosis of PCOS, but the sad reality is we're all aging every moment. So you're trying to mitigate age-related associated changes to your health, as well as navigating a diagnosis of PCOS on top of any other challenge we're thrown as a female.
Can you tell us a little bit more about the benefits of strength training? I feel like this conversation, I love my strength training, and I'm Asian, and when I was a little bit younger, I had aunties tell me, like, don't go to the gym because you're gonna get massive, or men don't, like, it's just really problematic conversations around, and I think some women still have this fear of going to the gym and lifting. Can you tell us a little bit more about how strength training works and what we should be focusing on, I guess?
Yeah, when we look at the World Health Organization guidelines and you look at the recent PCOS guidelines for exercise output out in Australia, and also just general guidelines just for women generally, at a minimum, we should be doing a collective 150 minutes of exercise a week, plus 2 sessions of strength or resistance training. And often when people hear that, the first thing is like, where am I going to fit that in my day? Start small, okay? Where you start doesn't mean where you end, okay? Make it achievable and something that you can build upon gradually. So finding those pockets of time into your day is quite critical. I think when someone says resistance training, I think to the uninitiated, the images that crop up are like big beefy men in the gym with their barbells and their weight plates, and lots of what we call gym bro grunting and huffing and puffing, and that's resistance training for that individual. But for you, it might look completely different. Start where you can build a relationship with this, because we want this to be a long-term relationship with movement and exercise. So you might start resistance training with body weight, okay? And I think the biggest mistake women make is when they find out that they need to be doing something, they go with an all or nothing attitude. I've got to do this and I've got to do this all right now. But we need to learn how to move properly to begin with. It takes anywhere between 4 weeks to 4 months to learn new movement patterns. So it does take a while to get the deadlift action, for instance. You're not going to just get it straight off the bat if you've never exercised or you've only dabbled in exercising consistently over time. So I am very big on getting women to invest time, energy, and resources into themselves by gifting themselves some one-on-one sessions with a physio or with a PT that's well versed in women's health and movement to learn how to move well. Because once you've got those foundations of movement, but also how to engage your pelvic floor and your core, exercise is easy moving forward, and it reduces your risk of having a setback later on down the track because you haven't just jumped into the deep end of the pool. So yeah, we want to be able to do it at least 2 times a week, and you can start with body weight and start with whole body movement, things like squats, squats and lunges, doing some chest press or, gentle bench press as well. Looking at moving big muscle groups, not small muscle groups, and using multi-joints at the same time. Because that's going to give you a better whole body workout rather than being specific. And that's what the research is telling us, that, in order to improve those outcomes with the insulin resistance or reducing your risk of type 2 diabetes and all the rest of that, that we need whole body compound movements done at least a minimum of 2 times a week. But strength training isn't always going to make you look like a beefcake. I mean, that all comes down to load and overloading your muscles for that particular outcome. And I seldomly find women are challenging themselves enough to achieve that bulky look. So rest assured, you're not going to end up with big bulging biceps by just doing body weight exercise. But if that is your goal over time to train for hypertrophy, know that your programming has to be quite specific around that.
So I guess with women coming to you with PCOS, is that something that you do in clinic? So do you offer sort of meet them where they're at and offer different sort of like training plans or advice around training?
Yeah, absolutely. So when women come to the clinic who have been diagnosed with PCOS, outside of a pelvic health challenge, they want advice around how to move and how to reduce their risk of developing those lifestyle comorbidities. We would write up an exercise plan. So where we would start is understanding what their current lifestyle is like, where they're going to fit it in, what do they enjoy to do with regards to movement. Because, I might be saying resistance training and they're saying to me, I hate resistance training. And so we got to listen to what works for the client and meet them where they're at to begin with before we lead them along that path of knowledge acquisition and skills acquisition over time to address their goals. And also just recognizing there's no silver bullet. It does take time, and you might not be consistent week 1 or the first month, but gradually over time that has a compounding effect. You just got to keep at it slowly but surely over time.
And do you support these clients over long term? Because one of my, favorite words to use around resistance training is progressive. It has to be progressive. Otherwise, it's not going to keep working. Is that something that you do? So you see people at different time points?
Yeah, absolutely. So what we might do is we might start with someone, seeing them weekly just to understand their body and their needs, assess them, and then build a exercise program and plan for them. Provided that they've got to the point where they're feeling confident and comfortable in the movement, then we might send them away to start executing on the exercise plan at home. Now, for those that need a little bit more hand-holding, we are more than happy to work one-on-one on a weekly or twice a week basis to get them to that point where they can feel comfortable and confident in their body, because our ultimate goal is to impart that knowledge and skills to the client to be an active participant in their rehab journey, and more important, to feel confident in knowing what they're doing isn't going to harm them and that it is effective. And once our patients graduate through that, they might only have to come back for a tweak every few weeks or a month where they need their program adjusted and changed. So we can work in many different ways depending on the client's goals and how much support they need. How do you support women in terms of seeking further advice and support for their symptoms?
So I think we do 2 things. So the first one is focusing on diet. I always am a food first dietitian. I think, food is really important. Food's also, nature's wonderful creation where nutrients that work together always come together. So things like iron and zinc always come together in food. So we focus on food first. I think a lot of people are always surprised. They think that when you see a dietitian, we focus on restriction, telling all the things you can't have, but that's rarely the case. We have more than enough things to talk about in terms of all the things you should be adding into your diet. One of the things we discuss is carbohydrate quality. So people sometimes think with PCOS, it has to be like a no carb or a 0 carb diet. That's not what the evidence says. It's also not fun to eat a no carb diet. It's more about being able to identify sources of, slightly more nutritious carbohydrate that come together with fiber and vitamins and minerals. So things like wholemeal bread, whole grains, quinoa, brown rice, wholemeal pasta. These are also delicious options that you can have. Portion control is something we think about as well. But it's not just about cutting portions down. It's more about readjusting. So having a moderate amount of carbohydrate, having a moderate amount of protein, which based on the kind of diet you have can be hard to do as well, and enough fiber. That fiber, so half a plate of fruit and vegetable, 90% of people PCOS or not don't get enough fiber. So it's a nutrient we really should be focusing more on. That fruit and vegetable does a lot more. So I think when we were in school, we were told, fiber helps you make good poops, which is great. Who doesn't want good poops? But it's got all the other things as well. So, all your antioxidants, which we know in PCOS, inflammation is the problem. So having different colored fruit and vegetables support that anti-inflammatory effect of food. The other thing we think about as well, like I said before, is the gut microbiome. The gut microbiome does plenty. It can affect your weight. It can affect insulin resistance. We know it can affect hormone levels as well. But when people think gut bacteria, the first thing they think of is probiotics. There's actually very little research looking into supplemental probiotics in a generally, well population.
I'm so glad you bring this up.
If someone, for instance, has, antibiotic associated diarrhea, then we do have science to say, this specific strain of probiotic can be supportive, but it's very specific, it's very prescriptive, and it's sort of very acute based on that situation you're having. If you're generally well going through your day-to-day, having, just a probiotic supplement is a drop in the ocean. Also because everyone's gut microbiome profile is very different. So giving two people the same bacteria could have very different effects. So instead of focusing on the supplements, we focus on having a wide variety of plant foods. So things like your wholemeal, pastas, whole grains, different fruit, different veg, legumes. So, legumes like chickpeas, butter beans, nuts and seeds, and herbs and spices as well. So a really varied diet is what supports gut health, along with things like,
how does one fit that all in?
I will say most people do okay. Most people have some sort of fruit and veg. I think, we do need to be a bit more deliberate with the nuts and seeds, with the legumes. And I will say it's about sprinkling. So even if you're having a salad or yogurt or muesli, sprinkling in some nuts and seeds, making a habit of that, making it accessible. So whether it's just putting a jar of mix, like pumpkin seeds and sunflower seeds on your counter, adding it to salads or yogurts if you're having that. If you're making rice at home in a rice cooker, adding different grains in. So, substituting like a quarter of it with quinoa, with buckwheat, with barley. You can still enjoy your rice, but we're mixing up those grains. So that variety is really good for gut health as well. So that's a diet side of things. We do look at supplements, although I will say that the supplements are individualized based on someone's diet and based on someone's symptoms. So I do see clients coming through on a whole cocktail of supplements. It's really expensive to be taking lots of supplements and also not fun to be taking a lot of pills. So I do think working with a dietitian can be good, where we sort of work out what symptoms are top of mind for you, distilling down maybe a handful of supplements that might be worth trying. In saying that, we also often try them out. Some supplements work for some clients, some don't, some have zero effect. And if they're not having an effect, then, not worth going down that rabbit hole. But no matter, I think supplements is at 2% of that overall piece. We can't run away from that foundation of, exercise, sleep, stress management, a good diet, which is a lot of work. I appreciate that. But I think often we overemphasize that supplement piece and don't think about, all the other ones. I had one question for you about exercise. I feel like the internet's a very divisive place. And I've seen people argue, about Pilates. But I also see people saying that Pilates is not a good form of resistance training. So maybe you can tell us a little bit more about, strength training, lifting weights versus Pilates and how that works for our muscles.
We're a bit divided on that, actually, on whether Pilates is considered resistance training. I think the reality is when it comes to Pilates, the resistance comes from the springs, okay? Now, the tighter the spring, the more resistance there is. Now, what I feel is happening in a generic group Pilates reformer class is that those springs, there's not enough resistance. They're often using a lower resistance spring, which actually isn't adequately loading muscle. Okay, so I feel like where we are at, if your choice is, Preet, I'm only going to do one thing, and I really love Pilates, I'm going to make you do Pilates to start you there, but also guide you and educate you on how to manage your springs so that you're sufficiently loading your muscles. Pilates is one of those things that it's not very functional. And so, at the end of the day, what do I really want from a client? I want them to move. So if they need to start and need to be met at Pilates, then I'd educate them on how to get the most out of their Pilates workout. But over time, I would like to see them come into the lifting realm, because we know when we look at all the research and the evidence behind what creates muscle adaptations, what changes your lipid profile, your blood sugar levels and all that insulin resistance, but also has amazing benefits for women who are suffering depression, anxiety, and all the rest of that, is actually comes from lifting the weights. You got to start somewhere, and it's okay to start with reformer Pilates, but just know it's not sufficiently loading or stressing your muscles enough to bring about those adaptations we need to make changes or see those changes in your blood test results, so to speak.
And I'm so glad you talked about sort of introducing people to foundational movements. I do think that the gym can be a really intimidating environment, especially for women. Some gyms you go there and it's just men, and you look at the machines and they look like torture devices, and like, how do I do this? How do I adjust the weight? How do I make sure I don't get crushed? But I think also, getting one-on-one help is more of an investment. But I think you're right, where that early, even a couple of sessions of one-on-one can give you that confidence to go and move comfortably and safely, because so many people get injured as well. I feel like, that it's really hard to draw that line of not overdoing things, but also moving in a smart way that is safe, and productive, and activating the right muscle groups as well.
Like I said, I think as a physio, we want people to move. As they say, motion is lotion, whether it's for healthy bowel motions or whether it is for lubricating our joints for an anti-inflammatory effects. I mean, we know that movement and exercise and eating well and not restricting yourself, unless medically indicated, is the way forward. Annabelle has kindly offered to put together a bit of a cheat sheet on how dietitians can help support women and how diet can help women better manage their symptoms when it comes to PCOS. And we'll also collaborate on that and put together a little bit of a cheat sheet around how to get started with exercise and movement and what that should look like for women suffering from PCOS and wanting to make a difference in terms of how they feel and how they navigate life.